How can you tell if your hip pain is nothing to worry about or a sign of serious trouble? My name is Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Everyone's body's different, but there are some common symptoms of hip pain and hip injuries that may indicate a more serious condition. If you experience any of these signs or symptoms, it's best to see your doctor, and sometimes as soon as possible. Pain in the groin and inner thigh. The groin and inner thigh are areas where the muscles and tendons of the hip connect to the pelvis. If you experience pain in this region, it can be due to a number of different conditions. First, a muscle strain. If you've recently lifted something heavy or done too much exercise without warming up properly, you might have strained the muscles in the front of your hip flexors. This type of injury is usually isolated and easy to identify because it causes sharp pain when moving or walking on that side. It can be accompanied by swelling in the groin area. Now, fortunately, most cases don't require medical attention beyond rest, maybe some physical therapy and home exercises until the symptoms get better. Osteoarthritis of the hip joint is almost always felt in the groin rather than the buttocks or gluteal region or on the outside of the hip. If you have pain in the buttocks, it's very likely coming from your lumbar spine, your lower back. If you have pain on the outside of your hip, it's very often caused by a form of bursitis called trochanteric bursitis. This bursitis is inflammation of the fluid-filled sac on top of the bony prominence on the outside of your upper thigh. It often affects adults who participate in activities such as running, cycling, and other repetitive movements over long distances without proper stretching. Also, pain in the groin of a runner, especially a female runner who's recently increased her training distance, could be a sign of a worrisome stress fracture, what's called a femoral neck stress fracture. These are dangerous injuries and often need surgery, so pain in this area with running and walking is worth seeing an orthopedic surgeon, and probably quickly. Now, a deep ache in the groin or in front of the hip that gets worse with activity but goes away with rest could be a sign of a hip flexor strain. To help relieve this pain, there are exercises you can do at home to strengthen the injured tendons. Sometimes a short period of rest and modified activities can help as well. If you have any of these symptoms, it's worth seeing a doctor or an orthopedic surgeon. Now, pain that's severe and gets worse over time. If your hip pain is severe and you can't walk around normally, that's another one that might be important to get checked out by a doctor. Again, remember, pain in the groin is often coming from the hip joint itself, osteoarthritis or a stress fracture. Pain on the outside of the hip is usually a type of bursitis, although pain for an extended period of time could suggest maybe a gluteal muscle or tendon problem. And again, pain in the buttock, especially if it radiates down the thigh into your leg, could be a problem with your lower back. And again, be very careful about groin pain that's getting worse quickly in a runner or running athlete. If you think you may have a serious hip condition, it's important to see your doctor as soon as possible. That doctor can help determine if your hip pain is something more serious than just bursitis or a muscle strain. I'd love to hear your experience with your hip injury. Leave it in the comments below. Please understand, if you leave a question in the comments, I can't offer you medical advice. I might answer your question though in a future video. Make sure to subscribe to my channel to be notified when I release a new video and when I start my next live stream, including my Ask Dr. Geier live shows. Thank you so much for watching. I look forward to helping you feel, look, and perform better than ever.